As the Medicare annual enrollment period approaches, millions of Americans will soon be making crucial decisions about their health care coverage for the next year. So joining us now to discuss what's new and what you need to know is the Chief Consumer Officer of Medicare Advantage at United Healthcare, Betsy Chin. So Betsy, thank you so much for joining us today. So first of all, tell us when this enrollment period is and why it's such an important time of year.
Absolutely. Thank you for having me. The Medicare annual enrollment period happens each year from October 15th through December 7th. And this is a key time for anybody on Medicare plans because it's the one time each year to consider what changes are going to happen to your coverage year over year and to choose a new plan if you'd like to. So again, those dates are October 15th through December 7th, and it's important because it's the one time each year to consider whether you want to make a change to your coverage for the next year.
And so what are some of the most important things to consider before enrolling in a new plan?
I would consider a couple of things. First, think about your health needs. This could include the doctors that you see, the types of conditions that you're managing, and any prescription drugs that you're taking. Each of these is an important consideration when you're looking to see what type of health coverage or Medicare coverage you need for next year. The other thing to consider is your budget. Each type of Medicare coverage has its own associated costs, could be a premium, deductibles, copay or coinsurance, and each of those things is important to consider whether the plan is right for you and your budget. And then the final thing to think about is the types of benefits that you're interested in. So all plans will include things like hospital coverage and doctor visits. But if you also want prescription drug coverage or extra benefits like dental, vision, or hearing coverage, a fitness membership, etc., those benefits are not included on all plans. So it's important to do your research and find a plan that both fits your health needs and your budget and has all of the benefits that you're looking for.
And then, of course, prescriptions, a huge thing, too. So how can people make sure that their prescription medications are covered?
Yeah, prescriptions are a very important part of most people's healthcare regimen. And so I would encourage you to check your plan's formulary. The formulary is the approved drug list for your Medicare Advantage plan or Part D prescription drug plan, and it can change year over year. So it's important to look at whether your drugs are still included on the formulary for your plan. And if they are, consider which tier they're on. So a formulary is divided into tiers 1, 2, 3, 4, etc. And each tier has a different cost associated with it. So if you can validate that your drugs are still on the formulary, and then you can find which tier they're on, you'll have a good understanding of the coverage and costs that you'll expect next year.
Okay, and then we've heard about some industry-wide changes to Medicare Part D prescription drug coverage because of the Inflation Reduction Act. So how will this impact, how it will impact people, I should say, with Medicare?
Yeah, so a couple of things that people should know about the Part D prescription drug program that's changing as a result of the Inflation Reduction Act. First is good news. The coverage gap, which is also known as the donut hole, is going away. So no more coverage gap on Part D prescription drug plans for next year. That's good news for consumers. The other piece that's good news is the out-of-pocket maximum is being reduced from $8,000 this year all the way down to $2,000 in 2025. So a nice price protection for consumers as a result of the Inflation Reduction Act. The one thing I would encourage people to do, though, is to look at the rest of the coverage. Things like the formulary that we just talked about, also the network of pharmacies that are included in your plan, and any other costs that might be associated with your plan. Things like premiums and deductibles, copays or coinsurance. All of those things may change year over year, and it's especially important this year to take a look at what those changes are on your plan. And if it's not going to work for you, this is the time of year when you can make a change to a different plan for 2025.
All right, October 15th to December 7th. Where can we go for more information on everything so that we can make our best decision?
For more information, please visit MedicareEducation.com.
Wonderful. Thank you so much, Betsy, for joining us again. It was great to see you.
Thank you.
Of course. And everyone at home, if you'd like to see this interview again, you can head to First Coast News Plus on Apple TV, Roku, or Fire TV.